I'm going to recognize, we're going to allow our amazing county executive to speak when he gets here, and I see Barry Hudson, so he's probably close by. But what I'm also going to do is take a second to recognize our Deputy Chief Administrative Officer, Betty Hager Francis, who is responsible for Health and Human Services and Education. Our staff of the Health Department, Betty Hager Francis is my boss. Okay. And so I'm going to move forward, and I'd love to recognize the Honorable Karen R. Tolles, who is a Prince George's County Council member from District 7. She is also the health person within the council, and also a good friend who made good decisions, except for a decision many years ago.
I wore red for you.
Okay. She wore red for me, if you understand. She likes pink and green, though. Councilwoman Tolles, if you could come up. Thank you. You look marvelous in red.
I remember the moment I got in trouble from Betty, though. Madam Chief said she has them red. I said it's not only for Pam Creekmore the holidays, but it's also for World AIDS Day. So I definitely had to find my one couple of red dresses I had. No, we joke about our organizations, but we're both doing amazing work in healthcare throughout Prince George's County. So with that, let's give Pam Creekmore a big round of applause. I have the privilege of representing the residents of District 7, but I don't know if it's most importantly or not important, depending on what time of the year it is. I am also the chair of the Health, Education, and Human Services Committee, and I have seen firsthand the work that not only Pam Creekmore does, but the entire health department. I am so proud of what the entire health department does. I have been the chair. I see it during the budget season, the grants that they go after, the funding, anybody, any organization that wants to help assist with issues, our most pressing health concerns, from AIDS to HIV to diabetes, many of the concerns we see in the county, it is the health department that is fighting on the front line. So I want to thank you very much. Speaking of health care, I did want to take a moment of personal privilege to represent my good friend, Melanie Griffith, the former delegate for District 25, but also she is the Vice President of Greater Bay Medical Services, AFQHC, here in Prince George's County. Thank you so much for being here. They are great partners with the health department. She's a former health department employee. So today is World AIDS Day, a time to recognize the ongoing progress to combat HIV/AIDS and the importance of supporting these efforts and those impacted by the disease. I could think of no better time to commend the Maryland Department of Health for providing additional funding to implement Prince George's County's HIV strategic plan and the Department of Health for leading the charge. Central to the vision and mission of the council is enhancing the quality of life for every resident. I know this is a vision that we share with the health department and with County Executive Baker. Yes, development in schools, as Mr. Majette talked about, and the tax base are extremely important. But for a growing, thriving citizenry, see, this is what happens when they write your remarks and you and strong economy to exist, we must first have healthy communities. And I study that many people who may or may not know that I have a background in public health, and so a strong and healthy community is critical for families throughout Prince George's County. And while HIV infections and diagnoses are on the decline nationally and in the state of Maryland, we are facing increased numbers here in Prince George's County. So this additional funding is timely and it is necessary. And that's why I said that when we have ongoing health problems, when we know that it's something we need to deal with, the health department under Pam Creekmore's leadership has been going out getting that money to make sure that we deal with our issues. And that's why this funding is critical and is of great importance. The health department has identified HIV is a public health priority in Prince George's County, and the HIV strategic plan will provide a clear avenue to address this issue. Education, awareness, testing, and treatment are key components of the strategic plan, and I know as implementation moves forward, there will be great news to report. There is a role for each of us to play in bringing the numbers down in Prince George's County. We can get tested. We can educate others. We can serve those who are living with HIV and do our part to dispel pervasive myths and stereotypes. I, for one, will be using today as a springboard to even greater levels of service concerning this issue. And I will be encouraging all residents of Prince George's County to do the same. And I hope you will too. May God continue to bless you and have a wonderful holiday. Thank you.
Good work to do.
Yes.
What I love about our county is that we pull together because there's much work to do, and we absolutely do it well and we get it done. And so I'm now going to, I'm going to introduce myself. I'd like to introduce you to Pamela Crickford. She's the health officer. That's okay, Prince George's County, and it is my pleasure to speak on this issue. We talked about how we used to recognize this day because we've been having World AIDS Day for many years, and we had a set pattern of events and things how we did them. And this year we wanted to do something different, and we had a reason to. So I'm going to thank the team here who came up with the idea to do a press conference around HIV. We've never, as a health department, done that in the county. And I think it's fitting now that we're doing it. I'm thrilled that our county leaders are here to support us. It's not because they've not been interested and involved, and they have been on us. What are we doing? What are we doing? And so I'm just going to speak a little bit about some of the trends and a little bit about the strategic plan. And I'll give you a summary. So one thing, we have become #1 in the state with new HIV infections. So I love being #1. I'm extremely competitive. I did not want to be #1 in this rate. We are not surprised, if I'm going to be 100% transparent, because over the last 6 years we've been increasing testing. We've been working hard with the legislators to change the opt-in, opt-out, working with the state and legislature. So we wanted to make it easier for people to get tested. When we like to say routinized testing. And what that means is I don't have to ask or decline to test. Add it to that CBC panel you do in the emergency room. Add it to all the things that you're routinely screening people for, because it should be done. We know that we have, as Minister Burgett said, 1.1 million people in the United States living with HIV today, but 1 out of 7 of those don't know that they have it. And so it really sounds simple. It has not been, and it really should be simple, to add that to your panel. So we really want everyone to get tested, just like I always tell the story. I had not been tested for HIV because I didn't look like somebody who had HIV, is what the physicians I worked with told me. My daughter was at the time 23. No, I'm going to take that back. She's 20. So the last time I had been tested was 20-some years ago, 20 plus now. And so when I asked the question, why hadn't anyone offered the test for me? Well, you're married, you're not the problem. I was like, Well, no, that's not the guideline. Also, that is a stereotype that is wrong. And additionally, it's a sexually transmitted infection. And everyone has sex. It is healthy. It is normal. And so the thinking out there in the community was a little dated, and we still have work to do there. And so routinizing testing means we're going to find more positives, but it also means we can expand the quality of life, and we not have to find people who find out when they have full-blown AIDS and they're in the emergency room or the hospital, and they've seen 50 doctors and nobody figured it out. So that is the real energy behind what we're trying to do, and we want to do evidence-based work. HIV trends in Prince George's County. So in 2016, unfortunately, we were #1 with 328 new cases, the highest in the state of Maryland. Additionally, 29% of all new HIV cases in Maryland are attributed to Prince George's County. We make up only 15% of the population. So there's an unequal balance going on here. And we understand, since most of you are employees in the room, that it is complex, and people don't look at borders and aren't concerned about borders. But the real fact is, it is an issue, and I always say it is 100% preventable. So as a public health official, we can't stop until it is, like I look at measles and smallpox and those kinds of things. There's no reason why there has to be new infections. Now, when we talk about, we wanted to do a press conference because we had some news. One, we're number one, we're not thrilled about it, but we own it. And it's a call to action for us to work harder and smarter and collaborate with everyone in the county, not just the health department, but everyone. We sometimes forget private practices and physicians and health groups out there who are testing people. Some are doing it routinely, some are not. We want everybody on this bandwagon going in the same direction. But we also completed a strategic plan with the great work of the Family Health Services Division, working with the state, working with partners in the community, and our administrative team from Brian White Part A. We were also able to get additional funding from the state to work on behalf of the high prevalence of HIV and providing greater access to our residents. And we got some money for prevention and STI. I get this question a lot, what is STI? I'm old enough to say it's STDs from back in the day. But it's not a disease, it's an infection. So it is sexually transmitted infections. But it's the same. So if you say STD or STI, all we're doing is showing how old we are, and that's okay. We are alive and we're happy about it. But there are some strategic goals within this plan, and one is to reduce the new infections, and that's where we really have to get creative and meet people where they are. The second goal is to increase access to care and improve health outcomes for people with HIV. The third goal is reducing disparities and inequities. And so if you wonder, well, we're in America, are there disparities, are there inequities? Absolutely. So our growth in new cases is in young men, young black men, gay, having sex with men, not considering themselves gay, or bisexual. There's a whole spectrum of this. And what I like to do is to talk about this chronic disease. I was the first nurse in the Visiting Nurses Association so long ago, I'm not going to tell you what the year was, who had an HIV patient, AIDS patient. I was the first nurse with an AIDS patient at the Visiting Nurses Association in Northern Virginia. It was new, and it was death. It was absolutely death, and many of you in the room lived through that. And so we kind of got complacent because it is a chronic disease. However, it is an unnecessary infection, and we can't get complacent, and we really should get to zero with this. And so while I'm thrilled and I'm old enough to remember, I remember every patient of mine that died on my watch. So I'm thrilled about it being a chronic disease, but we can't be complacent because the inequity of who the numbers are going up in today means that we've got to get smart, and we've got to get low, and we've got to get out in the community and get out of our heads on how we're going to reach people and communicate that this is preventable. The last thing I'm going to say, so I can get some of the other people to come up, is sexual health promotion. Well, I can't miss this. We want to train 1,300 local primary care providers, infectious disease, OBGYN, family medicine, internal medicine, on routine testing, resources, supports that people need around them when they're going through this process, and making sure that it's critical that people are linked to care. But when we get to talk about sexual health promotion, this is the thing, for me as a nurse, it's easy to talk about any and everything. The stigma around this boggles my mind. It is a chronic disease today. Sex is a healthy and wonderful thing. I am saying this to you because it is designed for pleasure and procreation. I'm just going to teach for a minute. That it's a healthy part of relationships and a life, a high quality life. Stigma around a HIV infection or a gonorrhea infection or a syphilis infection. The issue is silly to have a stigma. We all promote it. It's a healthy relationship. What we need to know is how to do it safely, okay? The call to action for me today is testing is required. I want my community, I want everyone in this room, I want all the providers to understand that 1 in 7 that does not know that they are HIV positive is why we have new cases, okay? So we're out there having a good time, healthy relationships and healthy quality of life, but we don't know that we are exposing others, okay? And then I'm going to end on, it is 100% preventable. It's simple, but it's not. Thank you, and I'm going to now introduce, okay, then you're going to have to help me again, because I'm looking at it, it's not because it's Anna Doze.
Yes, Onyeka Anadozie.
Anya Anadozie, the Deputy Director of Infectious Disease Prevention and Health Services Bureau, Prevention and Health Promotions Administration with the Department of Maryland, Department of Health of Maryland. Come on up, that is a long time.
Good morning, everybody. Good morning. So as Pam mentioned, I am Onyeka Anadozie. I am the Deputy Director for the Infectious Disease Prevention and Health Services Bureau in Maryland's Department of Health Prevention and Health Promotion Administration. And so first, I want to start by thanking Pam Creekmer, Diane Young, and everyone at Prince George's County Health Department for inviting me here to talk to you on World AIDS Day. So according to the Health Resources and Services Administration, the theme of this year's World AIDS Day is increasing impact through transparency, accountability, and partnerships. And so we at the department and Prince George's County, we have taken that message to heart. At the Infectious Disease Prevention and Health Services Bureau, we have been and we continue to be supportive of your local health department's efforts to expand HIV testing and healthcare services through community partnerships. And so even though it's true that new cases of HIV have gone down in Maryland and in the county, we still have work to do. Our young Black men and women continue to be disproportionately affected by the virus, and quite frankly, that is not acceptable. So we talked a little bit about this, but in 2015, there were over 400 new cases of HIV in the county. And that is the highest number of new cases in the state. Most of these new cases were among Black men under the age of 40. We cannot allow this to continue. So to address this, we have increased funding to the county to tackle these issues. We have awarded PG County's health department an additional $3 million for all sorts of programs, from prevention, testing, community partnerships, Ryan White Services, the entire gamut. Prince George's County has also put together a strategic plan that's modeled after the state plan, and I, quite frankly, am excited for what is in store. We have more tools than ever to work towards ending the epidemic. Pre-exposure prophylaxis, or PrEP, is available for men and women to prevent infection. Condoms are still here, and they still work. And we also know that those who are virally suppressed are unable to transmit HIV to their partners. And so I want to spend a little time on this, because this message is so important. U equals U, or untransmittable equals undetectable, is saying that scientifically, if you are virally suppressed, you can't infect your partners. So what this also means is that nobody needs to be in fear of someone with HIV. And I think this is going to go a long way to addressing stigma. And so stigma is a huge issue, and if we really want to end the epidemic, if we're serious about this, we have to educate ourselves and one another. So a recent study from the Kaiser Family Foundation shows that 38% of young people ages 18 to 30 still believe you can get HIV from using the same plates, glasses, or toilet as someone with the virus. 54% of those same young adults think HIV can be transmitted by spitting, and 58% think you can still get it from kissing. So we've got work to do. We all know that those things are not true, and we've got work to do in getting that message out. And so as a result of that, it's no wonder then people are afraid to get tested, afraid to start treatments, and they are afraid to talk about HIV honestly and openly. So we've got to work together to continue to educate our community and continue the strides that we've already made. And so this is going to take all of us. So on this World AIDS Day, I want everybody to get tested. I want everybody to know their status. And if you find that you are HIV positive, I don't want you to be afraid. I want you to get yourself into care and get yourself virally suppressed. Continue to educate yourselves and each other about the new treatments, about new prevention strategies, and the like. And so if we do all of this, I know that we can make a huge difference in not only PG County, but the state. Thank you very much.
Okay, thank you so much. I like that. Don't be afraid. It's nothing to fear. We're going to now ask Dr. Tremaine Davis, who is our medical director of our HIV/AIDS program, to come up, and our county executive is coming in, so he'll get to bring it up, bring in the rear. Good
morning. Good morning. So I am Tremaine Davis. I am the medical director for Family Health Services at the Prince George's County Health Department that covers HIV/AIDS, STD, and family planning. So over the last 3 decades, individuals worldwide have been affected by HIV/AIDS. During this time, many advancements have been made to improve and prolong the quality of life of these individuals. These advancements are not just limited to the treatment of HIV/AIDS, but it also includes prevention. PrEP, or pre-exposure prophylaxis, is one such preventive method. It is a daily pill taken orally by an HIV-negative individual that will reduce the risk of them acquiring HIV from sex by 92 to 99%, and if they are an individual who injects drugs, by 70%. So the question that we have now is who can receive PrEP? Any individual that is HIV negative, gay or bisexual men who have sex without a condom. And we know in our county that is where our increased new HIV infections lie. Individuals who engage in condomless sex, men or women. Any person with multiple partners. Any serodiscordant couples. So if you have one person that's HIV positive and the other person who's HIV negative. Okay, so you have married couples that are like that. IV drug users, sex workers, or some individuals that are a victim of crime, sexual assault, and they're afraid to say anything. All of these individuals are able to take PrEP. So anyone that we feel that is at risk for acquiring HIV can take PrEP. Now, while PrEP has proven successful, it is only successful if the residents in our county have access to it. Okay. The HIV rate in Prince George's County, like we heard, is high. It is high in our men who have sex with men, and it is high in our individuals under the age of 40, in particular African American men. There is currently very, very limited resources for us to use PrEP. At the health department, we are actively working to increase the accessibility to PrEP services by ensuring that all health department staff in the offices of HIV, STD, and family planning are going to get trained in recognizing any individual that is at risk for acquiring HIV. Now, we can all help remove the stigma and the shame associated with HIV. We can all promote safe sex practices. We can all get tested for HIV. We can all encourage anyone that we know to have routine testing. And we can all educate ourselves on PrEP. The Prince George's County Health Department is committed to decreasing the rates of new HIV infection. And we stand firmly behind the county's mission to protect the public's health and assure availability of and access to quality healthcare services. If you have anyone that is looking for PrEP services, a very good organization is the Greater Baden that we have. We have MarylandPrep.org, or you can just direct them to the health department, and we can get them the help that they need.
Thank you, Dr. Davis. So we are ready to, I would like to introduce our amazing county executive, Sharon L. Baker III. He's had a really big week, had a big day yesterday. I've seen him 3 times this week, which is rare. County Executive Baker, come up, please, and have any comments you'd like to, and we can close it out. Thank you so much.
First of all, we have an amazing health officer. Pam Creek Mary team have done a terrific job. So I want to thank them. I just wanted to make sure I came and, added my voice. The county is very serious about this. I want to thank Ms. Betty Francis for all the work that she's done. I've had a busy week. She's had a busier week. A wonderful week. We opened a new, regional medical center that's going to be built here in Prince George's County, which is going to be great for us to coordinate health throughout all of Prince George's County. But one of the things that we don't want to get lost, and it does sometimes in the sexy issue of the day. So whether it's opioids or whether it's, building hospitals, that HIV/AIDS, which a lot of people think, we've already dealt with. There's medicine for it, you live longer, and so therefore, we've dealt with that disease. That is not the case. That is why it's so important on this World HIV/AIDS Awareness Day that we look at the numbers right here in Prince George's County, with the fact that we see the numbers rising here as compared to the population of the county and the state. And that we get the message out, especially to our young African American males, that this is a preventable disease from happening if you follow these steps. And that awareness is something that we have to make sure happens. And so I'm glad as a administration that we never lose sight of when we say we want to make sure the county is protected, that this is a part of protecting the county and making sure that it's healthy. So I want to thank everybody for all of the great work they're doing, the great work we're going to do, and our goal, as I'm sure that Ms. Creekmer and others have said, is that we have 0 incidents of HIV/AIDS happening. That's where we are. Thank you for coming out. Guess what? We're done. Thank you. Spread the word. Keep everybody out there. Go for it.